My name is Randy Bigley. Joining me on the podcast today is Kate Seifert. She's from the Crawford County Health Department. Good morning, Kate.
Good morning. Thank you for having me today.
Oh, you're welcome. You know, the health department does a lot of stuff. And, you know, we think of COVID, but that's just minor compared to what you guys do. Much more than that, right?
Yeah, and actually I think a lot of people forget that pre-COVID, you know, we all had our full-time jobs there and all of our different programs, and then when COVID came on, we took that on, but we still kept doing all of our other programs. Sure. And, you know, we're pretty proud of the fact we never closed a single day during the whole pandemic. We stayed open and continued serving the public, keeping our programs going as best we could, and responding to COVID-19. So it's kind of it's not a four-letter word, but I want to condense it into a four-letter word sometimes.
Sure. I understand. I bet you do. But you guys deal with much more than COVID. You guys have all different kinds of great programs going on, especially for kids, right?
We do. We have several that are for kids. In addition to the immunizations that our nurses provide, you know, we have school nurses that go out to the schools every day and provide that service. But then we also have our WIC division. That's women, infant, children, and they're a focus on nutrition and nutrition education, and they work with the families with the mom prenatal, and then the kids up to age 5.
Okay, yeah.
And you do need to income qualify, but you would be amazed how many people, which both parents work, they still income qualify. And there are so many great resources available through WIC. They have their nutrition vouchers, and that includes like a fruit and veggie voucher. They do tons of education, and they're just one of our great resources here in our county. I sometimes think people forget about them. Right. They've been around for a long time, and the girls there that work there are awesome. They're so kind and so full of knowledge. So I always want to remind people that WIC is still here and they're ready to serve. And one of the things they did right before the pandemic, it was like August of 19, is we became an Ohio Health Mother's Milk Bank drop-off site, which means women that have an abundance of breast milk, more than they need for their own families, are able to donate, and we'll do the shipping. We'll ship it down to the Ohio Health facility where it gets pasteurized, and then it goes out to NICUs across the nation. I think the last time, the last time we talked to our friends at Ohio Health, they were serving like 72 different NICUs across the nation.
Wow, okay.
So those donations of that excess breast milk, they go a long ways in helping those little preemies who need it the most. And just yesterday, we had a donation of almost 2,000 ounces come in.
Fantastic.
Yeah, it was 7 boxes that we shipped out. So we're pretty excited. And even through the pandemic, people were donating because there was still the need. There were still babies being born and preemies in need of that donated breast milk. So
yeah, that sure didn't stop just because of the pandemic.
No, no. So, and then we also have our Help Me Grow division. So those are our social workers that are working with prenatal moms up to age 3 with their children. And they're working with the parents too. And they do the home visiting. They come into the home, they help the families, they have tons of resources available as well. And they didn't stop doing their work either. They changed it. WIC had to change it too. Sure. So they might do their visits out in the yard or on the front porch during the peaks of the pandemic. They did a lot of FaceTime. We provided people with tablets so they could talk to their social workers, and they just kept going. So they also promote a lot of safe sleep so that people understand the need, whether it's nap time or nighttime, about how to safely put your baby down to sleep. So we're still trying to work on improving our SIDS numbers and the number of deaths that occur from unsafe sleep conditions. So our social workers are amazing too. So I always want to remind those people to look out for those resources. They're free, they're right here. Those workers have so much specialized knowledge that you can really tap into. Yeah.
Immunizations you get out there at the health department, correct?
Oh yeah, yep. We do baby, child, school age, and seniors. So we still had people coming in, they needed their shingle shots. People still needed their tetanus shots. Babies still needed their measles, their mumps, their rubella, you know, pertussis. We're doing all those things, and that kind of never goes away.
No, it does not.
No, so those needs are still there because we don't want those diseases popping up either.
Correct, exactly. And that's where vaccines have come in handy.
That's right, that's right.
Where they've eradicated a lot of that, haven't they?
So one of the things too, we just hired a new health educator, full-time, Her name is Katie. It gets a little confusing because I'm Kate
Yeah.
and she's Katie.
Yeah.
We are ready to go. We want to partner more. We want to collaborate more. We saw so much need during the pandemic. A lot of what we do at the health department is surveillance of what goes on in the county. I can see a database and it's live time. So as events occur, the database updates. And it's all the reports of Crawford County residents that go to an urgent care or an ER in Ohio. It doesn't matter where they go in Ohio, but it goes into a database. And I can see Crawford County residents.
Okay.
The number of people falling and being seriously injured, even deaths from injuries from falls, a lot of times inside of their homes. So I see a strong need for us wanting to partner with our Council on Aging folks and really getting some education and awareness out there. One of the other things that we do frequently is monitor the suicide ideations.
Okay.
So I can sort the database, and I can even see the triage notes and the stories behind why people presented for a suicide ideation or attempt at a local ER. And so I see a strong need for us to really step up and provide more awareness. We really need to work on the stigma towards talking about these issues. And when we look at the age range, and so in 2021, there were 293 incidents of people reporting to a local ER urgent care for suicide ideation. Yes.
Wow, that's a lot. Yeah.
And that's actually very underreported.
Yeah.
Historically, a lot of people don't report to an ER because they're thinking about it.
Right.
So you really need to magnify that number to get a true picture of the mental health of Crawford County. And when I look at that age range, the youngest was 9.
Wow.
The oldest was 79.
Wow. Yeah.
And then our median age is 29.
Wow. Yeah, that's.
Yeah.
So yeah.
And it's all walks of life. Because I will sit down and I will read the triage notes. I will redact them and I share the ages 18 and younger with the school superintendents, just so they have an idea of what's going on. I'll redact it out, so there's nothing identifying. I'll take out the zip code. All they'll know is, 15-year-old female or something like that.
Yeah.
So they won't know for sure if it's their school or not, but they'll get an idea of the trends in our county, what is affecting the youth, since they have such a direct contact with that youth, and they can get it out to their counselors then. So that's one thing we started doing in 21, and I really want to expand on that and get that information out there more to their counselors and our local Crawford, Marion, Adam H. board. They are so great to work with, Brad and Paula. They're amazing. They do so much, and we want to help them to do more. So Katie, our new health educator, she's going to be rolling into that and making those connections so that people can just understand, and when we look at completions, those are the deaths. Those tend to be older. Our ideations tend to be younger. But all that does is illustrate that this issue has no age. It really impacts all of us. So there's work to do.
Yes.
There's work to do.
Yeah.
And when we look at so that was 293, and people think, gosh, then what's drug overdose? It's got to be bigger, right? Actually, it's not.
Really? It's lower, huh?
I know.
Yeah,
it is surprising. So these are, again, ones that report to the ER or the urgent care center. So that was 153.
Really? So yeah,
it's significantly lower.
Almost half. Yeah, wow.
Yeah. Now, a lot of times those two issues go hand in hand. A lot of people that are struggling, they're dealing with both issues. And again, our youngest was just a few months old with drug overdose.
Wow.
And then our oldest was 102.
Wow.
I know.
Yeah, right.
But then again, I should explain those young ones.
Yeah.
What this does, when I can read the triage notes with those, I can see they accidentally got into someone's purse or medication. They were crawling across the floor. They got into a purse and got into the pills.
Right.
Or they crawled into the kitchen or a bathroom and they opened a cupboard and they got into something.
Sure.
And then there's confusion on the other end with the older folks. The one, when I could read it, they got a new pill box. And instead of going across, they went down.
Oh, okay.
So they took 7 times one dose instead of 7 different pills.
Wow. Wow.
Yes. So you know, there's need for awareness and education on that spectrum, in addition to the opioid crisis and the high risk of fentanyl, and making sure that people that do misuse substances are aware just how deadly that fentanyl can be and how quickly. So there's a lot of topics and issues to cover. Again, we have stigma to overcome so that we can talk about these things, put the awareness out there, talk about naloxone with people. And you know, if you have a loved one in your home or in your family or a friend, and you know or you suspect, carrying naloxone is a simple thing you can do to help protect them. A lot of people have that approach that enables. It doesn't enable. You're keeping them alive until they're ready for treatment. And a lot of times those folks, they need that whole presentation of there's treatment, there's help, let's go, over and over and over before they're ready. You know, you're looking at a behavior modification. And that's not an easy thing to do. So loved ones and families and friends, one thing they can do is carry naloxone and be there for that person when they need them the most.
Now, Kate, a good way to get information that you guys put out is on your Facebook page, correct?
Yeah, I encourage people to follow us on Crawford County Public Health. That's actually me. I do our Facebook page, so if you're wondering who the voice is behind our Facebook page, 99% of the time it is me putting that information out and choosing the topics and creating the graphics. So. And
it's just reminders, not just COVID, you guys do a lot more than that out there.
We do a lot more than that out there. You know, I think we should talk about too is for our genealogy folks out there is our birth and death certificates go back to 1908.
No kidding. Okay. Wow. Yeah.
They're beautiful.
Oh, I bet. Yeah.
They're a little hard to read sometimes because the calligraphy is so beautiful but so slanted. But they're amazing. So yeah, we hold the birth and deaths, the actual certificates, all the way back to 1908.
Wow, that's great.
And then if you were born in Ohio, even if you're not from here, we can access any birth certificate in Ohio to get you a certified copy. So that's our registrars. That's Ginger, Barb, and Krista. And we also get a lot of genealogy folks coming through. They want to look at those old certificates.
Oh, I bet. Yeah, right.
They're amazing.
Yeah, I bet they are. Yeah. Very cool. Very cool. If someone needs to get a hold of the health department, what do they need to do? How they get a hold of you?
Sure. Our phone number, and we try. We get thousands of calls a month right now because we're still getting lots of questions on different things. But we try to do the actual personal thing and pick up the phone. It's 419-562-5871, and then our website is crawfordhealth.org, and then follow us on Facebook.
Where are you located at? Where's the health department located?
We're at 1520 Isaac Beale Road here in Bucyrus on the south side. Most people know us as the old Baja Boats building.
Yes.
Yeah.
All right.
We still describe ourselves that way too. We're just north of the airport. We have a beautiful brown awning over our main front door, and plenty of parking out there.
Okay, thank you so much for coming in today.
Yeah, thanks for letting me talk about all the things that we do out at the health department. I have an amazing group of coworkers that do so many great things and work so hard, and we just love serving the Crawford County community.
Awesome. Thank you so much.